Okay, this is the Affordable Care Act, a primer on what nonprofits and your families need to know. This is led by Courtney Watson with the Children's Defense Fund. Courtney, we really appreciate you helping us figure this out for our affiliates and our families, and your time, and we're glad you're here. We're really glad you're here. So take it away, Courtney.
Great, thank you. Can everyone hear me okay?
Yes.
Amy, can you hear?
Yep.
Okay, great.
Yes, but I think I'll go ahead and mute everybody. I'll just jump in and say that. And there's an option on your meeting burner. If you have any questions, go ahead and type them out while you're thinking about it, and then we'll have time for questions at the end. Does that sound okay, Courtney?
Sounds great.
Great, thanks.
You are now muted.
Great. Hi, everyone. As Amy said, my name is Courtney Watson, and I work for the Children's Defense Fund of Texas. I want to thank Amy for inviting me to come and give this webinar to you guys today, and for you guys joining me to learn more about the Affordable Care Act and to help you get the facts on how the ACA affects your nonprofit and the families that you guys work with on a daily basis. And let's see. All right, next. And I want to make sure, please let me know if I'm moving too fast and the slideshow isn't keeping up with me. Please let me know, Amy. Okay, so just a quick brief information about the Children's Defense Fund. We are a nonprofit child advocacy organization that works to ensure that all children have a successful start in life, including but not limited to access to quality health care and education. We have offices in the states listed before you, but our main office in Texas is in Houston, and then we have satellite offices in Austin and the Rio Grande Valley. We are also a nonpartisan organization. We do not endorse candidates, and we are very thankful that we have a very good relationship with both sides of the aisle. So this presentation is not meant for debate, but just to give you facts on what you need to know about the health care reform law. Children's Defense Fund of Texas works in collaboration with two groups. The first is Cover Texas Now, a coalition of consumer and faith-based organizations that work to implement a sustainable healthcare system and provide quality, affordable health coverage for all Texans. And then CDF is also lucky enough to be part of a group called the Texas Well and Healthy Campaign. We have a similar goal as the Cover Texas Now coalition that we work with, but we have a focus more on the grassroots work. That includes public education and outreach on the Affordable Care Act, and to basically ensure that all Texans have access to quality, affordable health care. We are comprised of 4 nonprofits, including CDF Texas, CPPP, the Center for Public Policy Priorities, Engage Texas, and Texans Care for Children. And I would encourage you to please visit us at texaswellandhealthy.org to get more information on the presentation that I'm about to give you. Excuse me. So this presentation is very detailed and provides a lot of in-depth information. I've laid out an agenda to guide us along. It should take us maybe about 35, 40 minutes. So as Amy said, we can leave the last 15 or so minutes for Q&A. And the presentation will first address the key aspects of the Affordable Care Act, give you some background on what it is, what the benefits are. Secondly, we will go into information about the marketplace, and then give you information on Medicaid and what the coverage gap means. I suspect that in your daily work life, and maybe in your personal life, you will run into both groups of people, those that are eligible for the marketplace, and then those that will unfortunately fall into this coverage gap, which I'll explain in more detail. And then finally, I'll give you some additional resources and provide ways for you to take action should you be inclined to do so. So what is the ACA? Let's jump right into it. The Affordable Care Act the ACA stands for the Affordable Care Act. It was signed into law officially as the Patient Protection Affordable Care Act 4 years ago, and is also referred to in the media as Obamacare and the federal health reform law. Since 2010, children, families, and individuals have already been benefiting from this law, and some may not even know that they're already receiving those benefits. The law will take full effect January 1st of 2014. As many of you know, the Supreme Court ruled in 2012 that the ACA was constitutional. It is now the law of the land. However, they did make one important decision, and that is that the states have the option of accepting federal dollars and expanding Medicaid to the poorest of those among us. And we'll get into that later, as I said in the presentation. So there are some key aspects of the ACA, and it's two specifically, that it provides first-time protections for consumers and creates new opportunities for coverage. These consumer protections are an important piece of the law that are really not talked about enough in the media, and many people are unaware of them and the extent of which they can and will be benefiting. First of these protections is the elimination of lifetime and annual caps. These caps were limits that insurance companies put into place so that if you got into an accident or experienced a major health crisis, they could then cap the amount of coverage you would receive at a certain amount for that year and even for your lifetime. This is an important provision that has never been existent before with the elimination of these caps. An example would be someone who was diagnosed with cancer and needed to have operations, chemotherapy, radiation treatment, or someone who was involved in a horrible accident. Many of you might know someone who has been in this position. It's a very scary time because it's very easy to blow past these arbitrary annual and lifetime caps. And by eliminating those caps, people who are in these extreme crises have the comfort of knowing that they will not have their coverage taken away from them and that they will be able to get the quality and the extensive care that is needed without worry of being abandoned by their insurance company when they are at their most vulnerable. The lifetime caps were eliminated in 2010. I've already spoken to several people who have expressed the thankfulness that they have because, for one mother, her child has been diagnosed since he was born, basically, with some sort of blood disease and has to get, extremely expensive treatment. And she was very worried about already hitting that lifetime cap by the time he was 13. So that lifetime cap being eliminated for 2010 has already benefited many, many people. And then the annual caps will be eliminated as of January 2014. So the no pre-existing conditions clause. This is another very important aspect of the law. For the first time ever, insurance companies will no longer be able to deny a person health care coverage because of a pre-existing condition. And everyone in this audience either is someone who has a pre-existing condition or knows someone who does. And that if they were left without health care, trying to get that health care with a pre-existing condition has been nearly impossible. Whether it be a chronic disease like asthma or diabetes or high blood pressure, or even conditions like cancer, you cannot be denied or discriminated against now because of these conditions. When I said earlier that some people were already benefiting from some of the Affordable Care Act provisions, you can see here that there has been no denial of coverage for children since 2010, and after 2014, anyone with a pre-existing condition cannot be denied coverage. Now, in addition to not being denied coverage, now the insurance companies can no longer charge you more and be discriminate against you because of your health history after January 1st, 2014. This will be a godsend for many Americans. There are three things that can lead to a higher premium, which is age, tobacco use, and geography. Next, another benefit of the ACA is the preventative care clause, which is care that consists of annual wellness checkups, your routine care for, say, asthma, your vaccines, your birth control, mammograms, cancer screenings, colonoscopy screenings, all these things that everyone needs to make sure that they are healthy and able to prevent future illnesses. Because of the Affordable Care Act, kids, seniors, and the disabled on Medicare have been receiving this free preventative care, meaning no co-pays every time you go to the doctor, since 2010. Everyone will benefit and get this preventative care in 2014. You can find a list of preventative care, all the different types of preventative care on healthcare.gov. Another provision and benefit of the Affordable Care Act is something called essential health benefits. This is the ACA's way of making sure that in 2014 all health insurance policies will cover these 10 essential health benefits. It's a floor, it's a minimum that they must cover. And people will be assured to have when they purchase insurance in 2014. I'm going to go through the list and say each one because I think it's very important to know what they are. So you have ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment programs. Prescription drugs must be covered, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services and chronic disease management, as well as pediatric services, including oral and vision care. The oral and vision care is limited to the pediatric services. These 10 categories are very important because, many people might say, well, I don't need maternity care. I'm not planning on getting pregnant, or, what do I need to have hospitalization covered for? I'm a very healthy person. But at the end of the day, we know that you don't plan on a health crisis happening. And when it does happen and you're in a position where you're in the past where your health insurance has not covered it, it can be a very costly and almost impossible situation for an individual at their most vulnerable moment. So now these essential health benefits must be covered up to some level on all the plans. Regulating insurance companies. This is a way that the ACA is protecting consumers by regulating some of the rules that insurance companies have had in the past. Excuse me. The first one is the 80-20 rule, and that went into effect in 2010. It is a rule that makes sure that the insurance plans are spending at least 80% of your premiums to your actual health coverage. The other 20% can go to marketing, business processes, and profits. So before, the insurance companies could spend as much, say, if your premium was $500 a month, your premium, they could spend up to, $250, $300, $400, however much they wanted towards their business profits, and then not towards their health care. This is no longer an option for the insurance companies. They must spend at least 80% towards your health care, and 20% can then go to them. In fact, many people began receiving rebates starting in 2012 because of the companies had to start obeying by this law. And on average in Texas, it was about $187 per check, and over $167 million were released in rebates. I am one who received a check from my insurance company because of this law going into effect. And it's interesting because I've heard of other states such as Virginia, Blue Cross Blue Shield, kind of as a marketing tool, sent letters to all of their clients saying that you would not be receiving a rebate because they have already been abiding by this 80-20 law. So I thought that was kind of interesting. But this is a great protection that can at least ensure that when you spend your money monthly, your premium must go towards your health care, whereas in the past it has not. Secondly is the rate review, which is a process that is inherent in the marketplace now because of the ACA, in which every rate hike of 10% or more must be automatically reviewed by the state insurance agency. Many times I've been paying my health insurance, my premium comes, I get a letter in the mail about my premium saying that my insurance company has decided to jack up my premiums for, $100, $150. No process, nothing I can do about it. It's just the way it is. Now there is a law in place that says any rate hike of 10% or more must be reviewed by the state insurance agency. The insurance company must post on their website that they are hiking the rate 10%. They must give their reasons why, and the clients of the insurance company, the individuals, now have the opportunity to go to the State Department Insurance Agency website and post the different reasons as to why this is hurtful and painful and not affordable. The insurance company then allows for this public comment, and then once reviewed can be deemed unjustifiable depending on what the reasons are given for the extreme increase in price on premiums. So that's something that you also don't hear a lot about in the news, that there are going to be rate reviews for any sort of increase in premium of at least 10% or more. Next are the Medicare provisions. I'm not going to spend too much time on this, but basically the ACA will close the donut hole, which is where seniors on limited incomes, once they've reached a certain amount of money that was spent by the insurance company that year, have been forced to pay full price for their medications, often leading them to not being able to afford their medications and not taking their life-saving medications. These are the stories that you hear about of the elderly having to decide if they're going to pay their electric bill that month or if they're going to get their medicine, if they're going to have to cut their pills in half and take half of what they were prescribed because they're trying to make it last all month or maybe into the next month. So the ACA closes this Medicare prescription donut hole by making these prescription drugs more affordable. And it's a process in which in Texas in 2011, the average savings was approximately $639 for each one of these elderly people who fell into the donut hole. And by 2020, the donut hole will be fully closed. And in the meantime, as I said, these rebates will continue for individuals to get their prescription at affordable prices. So the next part of our agenda is the health insurance marketplace. We're going to discuss what is a health insurance marketplace, how does the marketplace work, how can I get help enrolling, and talk to you about the affordability of it. The marketplace, formerly known as the exchange, you may have heard it talked about in the term of the exchange. The marketplace is now how it is referred to. It is a one-stop shop way of uninsured individuals to explore and research their health care coverage options. It is a federally facilitated website in our state because the Texas declined to run our own marketplace, and so we've defaulted to the federal government to operate. In the past, an individual, especially one without any prior experience or knowledge of health insurance, shopping for health care has been a huge undertaking, if not a nightmare. If you have, especially someone who has never had health care before and tries to shop for it, terms like deductible, copay, cost sharing, etc. are very foreign terms. Even I, who when I was on COBRA, it was about $600 a month for me to be on COBRA, and I wanted to go and research what my options were. And I found it, first of all, I was laughed off the phone because of my pre-existing conditions. And then when I was even trying to compare plans, it was impossible because it was so hard to compare the different types of plans and their prices. Whereas now, we have an opportunity to really compare apples to apples, side by side. And for the first time ever, we'll be able to actually shop based on 3 criteria that includes all 3 of price, benefits, and quality. So no more, well, this is all I can afford, so this is what I'm going to get. Now you can actually look more at the quality and what the benefits are. Many Americans are going to have an opportunity to get a break on cost with these subsidies if they qualify. I'll talk more about that in a moment. And then in addition, a very helpful component of the marketplace is that there is no longer that there is now a no wrong door policy with Medicaid and CHIP. So that means that anyone who applies for health insurance on the marketplace and actually qualifies for those programs will automatically be sent there and not get the runaround, whereas before it's been very hard in finding out if they can even qualify. So it helps streamline the process for those who are in need and qualify for Medicaid and CHIP. The website that you can use for the marketplace is healthcare.gov or ciudadesalud.gov for Spanish speaking. As you may have heard in the news and may have encountered, the marketplace is very popular and it has been overloaded with customers, and partly because of the nearly 20 million visits to the website in the first couple of weeks, the problems were aggravated. The experts are working to fix the problems. There are other options to enroll, which I'll show to you in a few slides. There's not only one option. The website is not the only way to enroll. But in the meantime, if you do want to enroll online, you can still preview the plans and the prices available in your area without filing the online application, and you can still use the calculator to help you figure out if your income and your household size qualifies you for lower costs on your monthly premiums and then your out-of-pocket costs as well. Quick just slide on the marketplace timelines and the dates you might want to know. As you probably know, October 1st the website was launched. People were able to go online, begin shopping and comparing prices. January 1, all benefits discussed earlier will be in effect, as well as the health insurance plans will go into, will begin on that day. If you enrolled in a plan by December 15th of this year, you can expect to have a start date for your coverage as of January 1. And then March 31st, 2014 is the last day for open enrollment for the year 2014. There are exceptions, such as if you lost your job, then there are and you no longer have employee health care, then there are options to be able to go into open enrollment sometime after March 31st, but those are exceptions. So as I said earlier, there are three ways to actually enroll in the marketplace. First of all, you do have a website, healthcare.gov, but you can also register and enroll via telephone. The number is 1-800-318-2596, and then you can also do it via in-person assistance. In fact, about 75% of a poll is taken, about 75% of those said they would like to have in-person assistance. And there are three ways to get in-person assistance. You can do it the traditional way with your agents or your brokers who have knowledge on the marketplaces, and then the navigators and certified application centers that have counselors available. A little bit more detail about the in-person enrollment assistance. Both navigators and CACs, as we call the certified application counselors, are entities that are trained and certified through the marketplace to offer knowledgeable in-person enrollment assistance at no charge to consumers in the health insurance marketplace. But there are a few key differences between the navigators and the ACA. Navigators are funded by federal grants to help people learn about their options and enroll in Medicaid, CHIP, or the private coverage marketplace. The navigators must conduct research or outreach, provide culturally and linguistically appropriate help, and provide access to individuals with disabilities. And then they can also assist small employers looking for health care on the shop marketplace, which I'll talk to you about later. The certified application counselors are people who are helping others learn about their coverage options and then enroll in Medicaid, CHIP, or the private coverage. So they're focused mostly just on enrollment, not outreach. Probably an organization or provider group that is already interacting with either uninsured or low-income folks would be the ones that would be the entities that have CACs. An example would be a clinic, a hospital, or a community organization. So this slide shows the coverage levels. They are the same levels that you see outside the marketplace and are already in existence. If you were to go shop for health care right now, you'll have a 90, 80, 70, 60 plan. The four primary levels or coverage tiers in the marketplace are called, we do it on a I forget the name of it, but the platinum, gold, silver, and bronze mineral plans is the way we kind of describe it. The way they work is that all of them have essential health benefits, the comprehensive scope of benefits that I described to you earlier, that is the floor level of what must be covered. But the real difference between these plans is how much you pay in a premium each month versus how much you're going to pay at the point of service in your cost sharing and your deductibles. So a platinum plan on average will cover 90% of your benefits, and then the individual will pay 10% through deductibles and cost sharing. You can see the numbers change as your levels change. The platinum has the same benefits as all the other plans, but the cost sharing is what is different. So let's say you have a platinum plan. You will have a higher premium each month, but you will have a lower deductible. So for example, I'm just throwing out numbers here, but with the platinum plan, let's say you have a higher premium each month than someone who's on the bronze level, but you will have a much lower deductible of, say, $500 deductible compared to maybe another plan where you have a lower premium, but maybe your deductible is $5,000. So you get to decide what is best for you. Are you someone who, like for me, I go to the doctor a lot, 2 or 3 times a month, and so the platinum plan is what's best for me because I want to be able to get past my deductible as quickly as possible and be able to just start my cost sharing and pay 10% of every time I go, every time I have some sort of health issue that I need to get seen for and have the insurance pay for 90%. So I'm okay with having my monthly premium be a little bit higher in order to get those cost sharing because I go to the doctor so much. So that is where the trade-off is with these plans. If you pay out of pocket each month for those premiums versus what you pay out when you get your health care. There is a 5th level of the plan that is available to some people. It is called the catastrophic plan. This plan is available only for those that are under 30 years of age, or if the marketplace determines that there are not any plans that are affordable for you. Affordable being the key word, meaning that they cost more than 8% of your income. So the affordability puzzle, we'll talk briefly about how this will be made affordable for you. There are several ways the ACA is making health coverage affordable. One way is through the premium credit and the various additional help with costs that includes preventative services, your out-of-pocket caps, and the cost-sharing subsidies. Who's eligible for these premium credits? It's a primary group of individuals and families between 100 and 400% of the federal poverty line. It's easy pretty much to find out if you're on the federal poverty level. You can go to healthcare.gov, or you can also just Google federal poverty level calculator and pull it up, and it's pretty easy to type in the information and just find out where you fall. To give you an idea, though, what a household is who is at the 400% level, federal poverty level, it is a family of 4 that makes approximately $90,000 a year. The premium credits are on a sliding scale that is relative to your annual household income. The more you make, the less premium help you will get, and those with the lowest incomes will get a higher premium credit. And to receive the premium credit, they are only available to those purchasing insurance within their marketplace. So if you go outside the marketplace and go directly to Blue Cross Blue Shield and not through the marketplace, you're not eligible for the credit. They are only available if you are entering and buying health insurance on the marketplace. The credit is paid directly to your insurer so that you only owe the balance as a monthly premium. So you would only owe the balance because that premium credit would be automatically applied. There are additional help with costs and no copay for recommended preventative services, which is a great relief for many. I've had, for example, my mom who wanted to go and get a screening, a colonoscopy screening. She was unable to do so because the cost was so high. So this is an additional way that you're able to get these basic things covered and not have to pay these extensive co-pays. And then also the out-of-pocket caps beginning in 2014. They apply to covered services, and there's a sliding scale in the caps within the marketplace for those who make less than 250%, who make less than 250% of the federal poverty line. So there's a cap now on deductibles in addition, which has been a major hindrance for those in the past. Many people you probably know have said, well, I need to go to the doctor, but I haven't met my $4,000, $5,000 deductible, or even $10,000 in some people's cases. And they're probably not going to, it's really hard to meet that deductible before insurance even kicks in. Now there are caps on deductibles for individuals and for families. So how does the Affordable Care Act affect businesses and nonprofits? The marketplace for small businesses and nonprofits is called the SHOP program. It stands for Small Business Health Insurance Option Program. It is run much like the individual marketplace, but is only available to those companies that have 2 to 50 employees. Only businesses with more than 50 full-time or 50 full-time equivalent employees must purchase health care for their employees. So that means that those with fewer than 50 full-time employees don't have to do anything. So if your nonprofit has less than 50 full-time employees, you do not have to do anything. I repeat that because it seems to get lost a lot in the conversation that we have. So fewer than 50 full-time employees, your nonprofit doesn't have to do anything. However, the opportunity is here that for the first time there's an option to be on a level playing field with the big companies and other nonprofits, so that now you can qualify and offer something affordable and useful for your employees. So many times in both the nonprofit and the for-profit world, the larger companies that have extensive benefit packages with great health care benefits, they're the ones that get the cream of the crop talent-wise when searching for their new employees. It's hard to compete with the larger nonprofits. Like I worked for the Sierra Club, and I had great health care benefits. But for a local nonprofit here in Austin that didn't offer health care, it's not as easy to get those folks who have a lot of talent, because they're able to go to a larger business or nonprofit and get these benefits that they need and that they want. So it kind of levels the playing field so that small companies can now offer the same benefits as a large company can. And this is because of the implementation of the ACA. So it's really an opportunity for small businesses to save money and to be able to get them the best and the brightest out there, and to make sure that their employees are covered. There are tax credits available to small businesses who decide to offer health care. They have to meet 3 criteria in order to get these tax credits. You have to have fewer than 25 full-time employees. The second benchmark is that your annual wages are less than $50,000 for that employee. And then third, that the employer pays at least 50% of the employee's premium, which is standard in the businesses right now. So nonprofits, as I said, are also eligible. Their tax credits are on a sliding scale as well as the for-profit. From 2010 to 2013, the premium expenses, the tax credits on premium expenses was up to 25% and up to 35% beginning in 2014. So they're done on a sliding scale, and they're for any 2 years that you decide to do them. A little bit of information for your HR people is that the tax refund is for the tax-exempt employers only. They include the amount on line 44F on the Form 990, and you would attach the Form 8941. You can find all these forms on irs.gov or .gov, or you can even just Google Form 990-T IRS, and it pulls the form right up. These amounts do not have to be publicly reported either. And just as an FYI, the mandate for any businesses with 50 or more employees has been delayed for 1 year, so that will not go in effect until 2015. Next, we're going to talk a little bit and make a shift to the Medicaid expansion and the coverage gap. So Medicaid expansion, the health care coverage for low-income adults, those from 0 to 138% of the federal poverty line. So that is someone who today only parents making less than $308 a month for a family of 3 can qualify for Medicaid today. Those numbers have not been updated with the cost of living or inflation since the 1980s. So just to let that sink in, a family of 3, anyone who makes over $308 does not qualify. About 1.5 million Texans would gain insurance coverage with this Medicaid expansion, and over 400,000 of these Texans would be children, because we have research that shows when parents are covered, children are more likely to be covered, even if they had already qualified for CHIP. The cost of Medicaid expansion. So the federal government picks up 100% of the cost for the first 3 years of the expansion to the adults. And then it slowly goes down. It goes down 5% starting in 2017 after the first 3 years, and then by 1 point each year until 2020. And then in 2020, no less than 90% every year after that. So the federal government would pick up 90 cents on every dollar. That means we would be paying 10 cents on every federal dollar that we received, which is a pretty amazing program compared to even any other federal program that is in place. Texas will also see an increased enrollment known as the welcome mat effect by those already eligible but currently uninsured children with the Medicaid expansion just because of the rollout. And then without this expansion, without it, we'll have over 1 million citizens and Texans who will have no coverage options beginning in 2014 because we have not taken these federal dollars. I want to give you an idea of how this affects large urban counties, many of the ones that you live in right now. So let's just take a look at Harris County, who stands actually to gain the most benefits. The yearly average just for Harris County would be about $953 million would be coming into Harris County every year. That would bring the uninsured down from 1 million to 223,000. From 1 million to 223,000. You can also see the major effects that this would have on El Paso, Dallas, Lubbock, and Travis counties. It's pretty staggering, the impact that these federal dollars would have on low-income working adults and children. So if Texas decides to opt out of this Medicaid expansion, uninsured Texas adults below 100% of the federal poverty line will have no assistance available in 2014. Those, however, from 100 to 133% of the federal poverty line will be eligible for premium assistance in the marketplace. So basically that means the poorest among us will not have any options for coverage. The cost of care for these uninsured poor Texans adults will be continued to be carried locally by property taxpayers such as you and I, and then by other charity care providers. So when the emergency health care services for uninsured people are paid locally, we do not get the benefit of that 90% plus federal matching funds. So what happened in Texas this past session? In 2013, January through, I guess, June, throughout the special sessions, the 13 House and 6 Senate bills were filed to expand Medicaid per the ACA, and this included Republican leadership. So there was widespread support. We had statewide support. We had doctors, hospitals, the Texas Hospital Association, the Texas Medical Association, county officials, chambers of commerce, even the Texas Association of Businesses supporting what was called the Zerwas coverage option or the Texas solution. We did polling that showed that 58 to 59% of Texas voters supported accepting these federal funds to cover the poorest uninsured adults, and even the 22 chambers of commerce called on the state to accept this funding. New chambers are continuing to join every day. The major Metro 8, those that include Harris County, or Houston, Dallas, Austin, Fort Worth, Arlington, El Paso, the large urban metro chambers all came out in support as a unit, and then even the smaller ones in the rural areas, because the rural areas are really going to benefit as well, such as Lubbock, Longview, those sorts of places came out in support for the expansion as well. Now, the Zerwassen bill with HB 3791 was called the Texas Solution, and it was where it would allow the state to draw down the federal funding set aside for the expansion to subsidize the private health insurance for low-income individuals. This had bipartisan support. It was voted out of committee, and we personally did an informal survey of various House members, Republicans and Democrats, and our survey showed and indicated that there was a majority support for this passage, and our House leaders wanted to bring this bill to the floor. However, it was never scheduled due to a threat of veto from the governor's office. So what's next? Texas's decision means that in January 2014, Texas adults above the poverty line, 100 to 400% will get publicly funded sliding scale help with health insurance, but Texans below that poverty level will qualify for nothing. The estimates show that from about 930 to 1.3 million Texans will be left uninsured and without options. And Texas, just FYI, does have the opportunity, if the governor should change his mind, can at any time accept the available federal funds to expand coverage to low-income adults. So what can we do to make sure that those that we work with on a daily basis who are going to be falling into this coverage gap, can try to get this coverage that they so need and deserve? We ask that you get involved and stay informed. So just to give you an idea, I want to give you like an everyday living idea of what this means as of January 1st. So, and how thin the line is. An uninsured parent with 2 children who lives on $18,000 a year will have no help from the ACA for health care coverage because we didn't take the federal funds because the state did not. So a parent with 2 children makes $18,000 will not have help, but another uninsured parent with 2 children earning $20,000 a year will qualify for full coverage on a sliding scale for $33 a month or less. So that is where we're at when you're looking at what kind of families are going to be affected. A diverse network of Texans and organizations are still working to find health care for these Texans in the coverage gap. We're asking them to tell their stories, seek inclusion of Texas working poor into health care reform. We have resources for you to offer these families that you may encounter if you want to help them try to find health care. We recommend that they try to go to one of the 400 community health centers that they've had access to in the past. A lot of these FQHCs have a sliding scale care for uninsured, including immigrants without current legal papers. And then in communities, you can call 211, and they may be able to connect you to regional and county programs and charity care programs and clinics. It really depends on what's available in your area. And the rural areas are going to be the ones that are unfortunately going to be really hurt by this because they just don't have a lot of those options available. And for those people that, once they understand they're in the coverage gap, they're pretty angry about it. And if they want to do something about it, there is some advocacy options available where they can go to texasleftmeout.org or tejasmedejoatras.org, a Spanish version, where they can sign a petition and share their story. And then also we encourage them to go to texaswellandhealthy.org because we are not giving up this fight, and we will be continuing to fight for those who are uninsured and the poorest among us. Just as a closer, to give you an idea of where we're at right now, to cap it off, we have Health Insurance Marketplace, healthcare.gov is available. You can go to the website, you can call the phone number, you can get help at some of your local clinics with the navigators and find out where your CACs are. And then we now have these health insurance reforms and consumer protections are in check. It'll be fully available and rolled out as of January 1. The interaction between the Texas Medicaid and the federal marketplace is still ongoing. We're still fighting it. But right now we do not have the Medicaid expansion to help those most vulnerable among us. And then right now in progress is the outreach and enrollment, which we are doing. CDF is involved in, as well as Texas Well and Healthy and all the organizations in the Cover Texas Now campaign. So thanks very much for letting me be here and to give the webinar and give you the information. I'm going to take questions here in just a second, but if we're not able to get to your question or one comes up later and you'd like to ask me, feel free to email me at cwatson@childrensdefense.org. I don't claim to know every answer to every question, but I do promise to get that answer and get back to you if I don't know it myself.
You are now
unmuted. Feel free
unmuted.
to email me. I do encourage you to go and check us out at cdftexas.org and learn all the amazing work we do for children around the state and the nation. As usual, all the social media, you can get us at CDF Texas on Facebook and Twitter. And this is brought to you by Children's Defense Fund Texas, Texas Well and Healthy. Thank you very much, and now we can take questions.
Thank you, Courtney. Just the phones are unmuted, so ask away.
Amy?
Yes.
This is Olinda. My only question is from an employer standpoint, I'm going to have to be paying so much a month since we pay all of our employees' insurance. Do you guys have any info on that?
I'm sorry, I had a hard time hearing you. What did you say?
I said, as an employer, we are paying all of our health insurance for employees, and it's going to require a monthly fee that we must pay in addition to their premiums. Does anyone know how that's figured?
How many employees? I'm sorry, Courtney, this is your show. Go ahead.
No, how many employees do you have?
Just about 9.
9 employees. And you pay for all 9 employees' premiums, correct?
We do, yeah.
Who is your insurance provider?
Blue Cross Blue Shield.
Cross Blue Shield. Okay. I have not heard of anyone having to pay a monthly fee under the Affordable Care Act.
Well, it's there, dear. And it's a percentage. So I'm trying to figure out what it is.
Yes, I understand. What I'm trying to say is that this is the whatever fee you have is something that has already existed. It's not anything new. And if you were to go and if you were to go and buy insurance in the shop marketplace, I'm not aware of any fees that would be given to you that you would be charged for. So that is something that I believe Blue Cross Blue Shield is doing on their own. I have not heard of any monthly fees in addition to paying your normal premiums.
Maybe not as an individual, but as a company, I think there is.
Okay, well, that's something different. I am not aware of that. I can go and check on it for you and get back to you if you'd like to give me your information.
I'll tell you what. I will get with Blue Cross Blue Shield, but I was just curious if you had heard anything. Because I've been hearing about that for months coming down, but I just didn't know how big a hit it would be.
If it does, it's not coming from the Affordable Care Act. It's coming from their own insurance ideas. If you were to go within the exchange or within the marketplace for businesses, there should not be a fee at all for the organization.
Not for individuals, I know, but I've been hearing this for years, and I don't. Well, I'll find out what I can, and I'll shoot it back to Amy when I do.
Please do. I'd love to hear about that.
Okay, thank you.
Hey, Linda, will you get back to me because I like Courtney have heard that since you have 9 employees that it's not gonna. The Affordable Care Act does not apply to you. So, but I also have heard that Blue Cross Blue Shield is making some changes and blaming it on the Affordable Care Act. So, I would love to know the answer to that.
So what you're saying is if we had more than 50, that would apply. Since we have less than 50, that doesn't apply. Is that what I'm hearing?
No, ma'am. If you have more than 50, yes, you would. You would have to have health care for your employee. But this fee that you're talking about, this nominal fee that you're saying that the organization has to pay, is not something that I have ever heard of with the Affordable Care Act. So that is something that your particular insurance company is charging you.
We'll see.
That has nothing to do with how many employees or anything, as far as I know. Okay.
I'll get back with you. I mean, when I do finally, get this tracked down, because I've been hearing about it for months,
Okay,
through from different sources. So let me see, what I can find.
I'll also do that as well on my end as well. I will go and see what I can find out because, like I said, I've done a ton of research and worked with Small Business Majority and even Blue Cross Blue Shield myself. I gave a presentation a couple of months ago, and he was really great. They're actually doing everything they can to be meaningful to the Affordable Care Act, and so I'll call my contact with Blue Cross Blue Shield and ask him about that myself and get back with Amy too.
Okay, I appreciate that. Thank you.
Sure, thank you.
Okay, if there are no more questions, then Courtney, I really appreciate your time.
I do have a question.
Oh, go ahead.
I'd like to know, how are they handling if you're retired and you're under a union and your union pays your med? I can't find anything when I'm doing research on that, and they pay your health care. Will the union get with us on our health care?
So you get your retirement, your health care through your retirement with the union?
Yes.
I would contact your union and ask them information. I don't have a whole lot of information of how unions are being affected, if they are and how they are. So I would definitely talk to your union representative and find that out.
Right.
And if any other people have questions that come to you, because I know this is a lot of information to take in at once, I am also happy to have you contact me directly at the email address that you see. Because the more information the more questions you ask, the more I learn as well. So it's a win-win.
Are there any more questions for Courtney?
I guess if there's no more questions, I just want to say thank you all for letting me, take an hour of your time today and give you this information. I have worked with Habitat Humanity or volunteered in the past, and I admire the work that you guys do in the communities. You do such great work for people in need, and I hope that you can carry this information to those families that you work with, because I know that they're probably having a lot of questions. And many people are very excited at the opportunity to actually be able to take themselves and their children to the doctor. So please let me know if I can give you more information, if I can answer any questions, and thank you for all the work you do in the community.
Thank you, Courtney. Y'all have a good weekend and a happy Halloween. Happy and safe. Bye-bye.
Bye-bye.